Hello friends. Today we'll continue our Know Your Cancer series in which we'll be discussing a cancer in detail starting from its causes, symptoms to its treatment. Today's topic is oral cancer. Oral cancer is among the top 3 cancers in India, both in men and women. What are the causes of oral cancer? Tobacco is the most common and important cause which everyone is quite aware of today. It can be in the form of smoking or a chewable tobacco along with betel nut, etc. Commonly, causes of oral cancer are named as 5 S's. Smoking is the first S, spirits is the second one. Alcohol is usually consumed along with smoking. They both go together. So if a person smokes, they usually have a habit of alcohol, or while drinking, they have a habit of smoking. So both of them have an additive effect and increase the risk of each in developing oral cancer. Third common S is spices. The spicy food we eat, especially in this region of India, that is South India, the consumption of spices is quite high. So that is found to have a correlation with an increased risk of oral cancer. Then we have syphilis, which is not quite common today. The fifth S is sharp teeth. Sharp teeth, over time, they keep on causing friction to the inner lining of the mouth or on the tongue and may result in developing oral cancer. Another common S is a submucous fibrosis. This is again a consequence of smoking or any of the 5 which we have discussed above. That is, under the lining of the oral cavity, the tissue becomes hard, and this is a predisposing factor. Other cause, as we usually discuss, is genetic, where there are young people who do not have habits. Even then they have a chance of developing oral cancers. How do we identify oral cancer? Among all the cancers in the body, oral cancer is the easiest to identify. Usual symptoms are either an ulcer or a swelling in your oral cavity. So the very important factor which we need to remember, if you develop an ulcer which is painless and persists, that is, it is there for at least 2 weeks. Ulcer which does not heal for 2 weeks is a very important symptom which people have to remember and have to get examined. In the late stage, when the tumor has grown quite big, it may cause swellings on the face. Sometimes it may come through the cheek and cause a swelling on the outside. If the ulcer is on the tongue and it goes into the muscles which supply the tongue, there may not be movement in the tongue. There will be a change in the voice. Most of the patients we see are usually at a late stage. Sadly, it's one of the most neglected cancers, though it is most easily identifiable. That is because of the general stigma. People usually do not want to consult a doctor because they are scared that it might turn out to be malignant. There is a stigma within the community because they have already been warned about stopping their tobacco, and they know that because of their habits, which they are not able to control, it has resulted in these symptoms, and they know it is probable to be cancer and they postpone, hoping that it is not so. So sadly, we do see almost 2/3, that is 60 to 70% of our patients who are at an advanced stage of cancer by the time they reach us. Please do remember, if we find this at an early stage, it is very much curable and among the most curable cancers in the body. Next week, I'll be discussing the investigations and the treatment aspects for oral cancer. See you soon. Take care.